Blair Davison of St. Pat's for another edition of Morning Rounds. Thanks for waking up with us.
Well, thanks for having me.
Of course, today we're talking about spring exercise. So what are some things to keep in mind if you're ready to get outside and just get moving around?
Exactly. So we are all a little stir crazy and
cabin fever.
Exactly. Ready to go, warmer temperatures. We get ambitious. Maybe we haven't been doing as much exercise over the winter. So the first thing is be reasonable with yourself. If you haven't been doing much exercise, take it easy. But one great thing to consider is changing up your exercise routine and trying something new.
So what is HIIT?
So HIIT stands for high intensity interval training.
Okay.
And the thought behind it, and a new study came out that looked at a group of studies and about 1,000 individuals. And what it demonstrated is that this kind of brief, intense exercise, where for a few minutes you really go all out, and then you rest for a short period of time and then hit it again, can be really great for aerobic fitness and also weight control. And it was demonstrated in this one large meta-analysis that high intensity interval training, so like 25 minutes of alternating between really intense bursts of exercise and brief periods of rest, does the same kind of good that going for, 45 minutes of a moderate intensity.
And it's over faster.
It's over faster, but you got to remember that while you're improving aerobic function and you're getting blood sugar control, that you do want to make sure you're not exposing yourself to risk of injury. So this is something that you should really get a program and not just wing it. Exactly.
Well, what are the benefits and what is a typical workout?
Yeah, so the benefits, as I said, improving aerobic function, getting your blood pressure under control. Another thing is that really exercise is a great cure for anxiety. Believe me, if you're going all out for 2 to 3 minutes, you're not thinking about anything else except when is 2 or 3 minutes over. And so it's also good for fat reduction and some benefit for weight reduction. So the important thing is to not get too focused on the scale, because what we know is that if you stick with this kind of exercise, you are changing your composition. So you're moving pounds from fat to muscle, which is great.
And so what are your typical workouts for this kind of exercise?
Yeah, so what's it look like? So again, it's about a 25 to 30 minute period where you alternate between like 3 minutes of really almost your maximal exertion. So that's what you perceive to be the best that you can do. And then you rest for a less amount of time, and then you go again, but you increase the intensity and lower like the repetitions.
Okay. So what's the anything special before you start? Any typical workouts?
Really good points. So if you don't have any chronic medical conditions, so if you don't have diabetes or you don't have a known cardiac problem, go ahead and embark on your exercise. If you've had symptoms while you're exercising, like chest pain, shortness of breath, or you have a known chronic condition, check in with your primary care provider before embarking on any kind of exercise regimen.
All right, so then in the end, I guess, is this better than that 150 minutes or a week of moderate or regular exercise?
So here's what I think is so important to take away. Find what you like to do and have confidence that they're getting the same job done. But the reality is you want to rest for 24 hours between these high intensity workouts. So think about mixing it up.
Okay.
So maybe 2 or 3 times a week you do the high intensity, and then the other 2 or 3 times you do a more moderate walk with your friend or something like that.
All right, well, thank you for some of those tips to get us outside and exercising this
Exactly.
spring. If you have any questions you'd like us to answer, you can email them right to us, morningrounds@kpax.com.